Dr. Donah Asiimire, Senior Lecturer at Bishop Stuart University. I am part of the research team that is working on the exploration, adaptation, and pilot testing of male-focused group family planning intervention in Nakivale Refugee Settlement Camp. This project is funded by Center for Global Health Equity under Impact Accelerator Grant. From BLCU, we are Dr. Johnson, Bertram Namanya, and the Right Reverend Professor Fred Sheldon Wesigwa, working with the research team from University of Michigan that include Professor Heighten, and then we have Camila, who is the PhD student. We also have Lynn, and together we are working under this grant to implement this project. Now, ever since we started, so far we have been able to interact with the community. We visit Nakivale always. We have tried to familiarize with the target population. Now we know the setting of the camp. We know how people of different nationalities behave. Now, as a team, we have been able to also collect data. So far, the data we have collected, caters a lot of variables within our study, and they include intimate partner violence, maternal health, family planning, male engagement, and we hope this is going to support the interventional activities going forward. In addition to that, there's a very strong component of male engagement, and this is very powerful when it comes to the empowerment of couples, especially in decision-making as far as family planning is concerned and general maternal health. There's a way how this study is going to also empower families. It is going to empower the communities. It is going to empower the general well-being of families within the setting. To mention as well is how this study is being embraced and welcomed by the healthcare providers. The healthcare providers have shown interest in this study, and so far I can tell that the way how they are responding, the way how they have shown interest, they are likely to have this study included or integrated within the routine activities of maternal health. And so you can see how this study really appears to be so needed and urgently needed because of its uniqueness. If I can mention as well, it stands out how, because as global partners, we see a very strong component to do with the fairness in terms of authorship. Fair distribution of authorship is very key for our career development, and that is what we are also made to do in the academia world. It also supports our universities. We need this global visibility. As BSU, it fits even in the strategic goal 8 of our university. So we need this as global partners to sustain our universities and to increase the global significance. I also need to mention as well that the issue to do with gender are a global concern. They are a global concern because it fits in Sustainable Development Goal 5. And so when we are talking about issues of gender, health, male engagement, we are supporting a number of sustainable development goals, but specifically shooting in Sustainable Development Goal 5. Finally, I need to mention that this study is something that we have all taken to learn from, because it provides us a platform to experience different research expertise, research competencies. We meet weekly, and all this time that we are spending to do this work, we have found ourselves grow in terms of research capabilities. So the diverse research exposed and already shared in the group is really enough that even when we expand this study to other camps within the country, we are able to handle. So I want to appreciate the funders for taking this as a core issue and supporting this study. I want to thank you so much and wish you all the best.